Telehealth Rocks recently hosted a workshop that brought together caregivers and educators to explore new ways of supporting children through a trauma-informed approach. The program is called CARE, Child-Adult Relationship Enhancement. This video will highlight the key takeaways from the workshops to help you put CARE into practice. Whether you are a parent, grandparent, educator, or caregiver, these simple strategies can strengthen your relationship with any child, not just those facing behavior challenges.
My name is Zhang, and I am a board-certified behavior analyst at the doctoral level. I work at the University of Kansas Medical Center.
My name is Leni Swails, and I'm a PhD clinical child psychologist at the University of Kansas Medical Center.
First, let's talk about what to avoid, or the 3 cues, when you are trying to follow a child's lead. The first cue is questioning the need to lead. This means stepping back from unnecessary commands. For example, instead of saying, "Draw me a house," let the child decide what to draw. Giving directions takes the lead away from the child and can create frustration for both child and adult if the child does not follow the directions. Try creating unnecessary information questions. When you ask, "What sound does a cow make?" or "What are you building?" it can feel like you are steering the conversation instead of listening. Create tone of voice questions. For example, if a child says, "I'm going to color the dog purple," and the adult replies with, "You are coloring it purple?" This may lead the child to think that you aren't listening or that you are disagreeing with their idea, even if you did not mean it that way. And finally, quiet the criticism, such as statements with words "no," "stop," "quit," "don't," "not." Negative talk often fuels negative behavior. Instead of saying "stop being silly" or "stop running," look for positive behaviors you can highlight and say, "Show me your walking feet."
So, if we're avoiding commands, questions, and criticisms, what do we do instead? That's where the 3 P's comes in. The first P is praise. Use specific praise to reinforce positive behaviors. Instead of a general "good job," you might say, "Good job for putting the toys away." Think to yourself, "Good job for what?" Specific praise tells the child exactly what you like about their behavior, so they know what to do again in the future. Specific praise is more powerful in changing behavior than punishment or fear is. It causes a child's good behavior to increase and makes them feel good about themselves. The second P is paraphrase. When a child says something, repeat it back in your own words. For example, if a child says, "My shirt Elmo," you might respond, "Your shirt does have Elmo on it." This shows you're listening. It encourages more conversation, and it supports language growth. It's also a strategy that therapists use to make someone feel really heard. And the third P is point out behavior. I want you to simply describe what you see the child doing. For example, you're building a pickup truck. You're looking for another piece. You found it. This helps them stay engaged and builds language skills at the same time. It also shows the child that you are interested and you're watching everything they do. It teaches them new concepts or ideas, and it's going to help them focus and pay attention to the task for longer. These tools may seem small, but they make a big difference. When you reduce commands, questions, and criticism, you create space for the child to feel confident and in control. And when you use praise, paraphrasing, and pointing out, you're strengthening your bond, encouraging positive behavior, and supporting healthy development. We encourage you to use these strategies with the children in your life, even just for a few minutes a day, because it can have a lasting impact.